Diabetes is a lifelong disease which has a high level of sugar in the blood. It can be caused by too little insulin resistance or both. People with diabetes have high blood sugar levels because the body cannot move sugar into fat, liver, or muscle cells to be stored for energy. There are different types of diabetes. You have type 1 that can occur in any age group, but diagnosed in children, teens, and young adults. This is the disease that the body makes little to no insulin, and there are daily injections that are needed. Type 2 diabetes makes up most of the diabetics occurs in adulthood, but teens and young adults are now being diagnosed with it also. And there's the last type, which is gestational diabetes, which is found in most pregnant women that are not diagnosed in diabetes in their everyday life. Symptoms of diabetes would consist of high blood sugar levels caused by blurred vision, excess thirst, fatigue, frequent urination, hunger, and weight loss. In type 2 diabetes, it develops slowly, but most people with high blood sugar levels have no symptoms. In type 1 diabetes, it develops over a short period of time, and you may be very sick by the time you're diagnosed with diabetes. There are different tests that you can use to test for diabetes, but none of them are all permanent. You have to go through different stages. Testing includes urine analysis. It may be used for high blood sugar levels, but this test alone does not diagnose diabetes. To confirm the diagnosis, one or more of the following tests must be performed. Fasting blood sugar glucose level test, the hemoglobin A1C testing, and an oral glucose tolerance test. All of these combined together could be a sure way to diagnose diabetes. Treatment for diabetes. There's no cure for diabetes, but treatment involves medicine, diet, and exercise. All these together can prevent the low blood sugar levels, and it helps you maintain your sugar levels, therefore you won't get sick. On interviews, my grandfather has diabetes, and you can always tell sometimes when his sugar levels are low. You'll see him laying around or moping around the house, and you'll see him grabbing candy. But sometimes my grandma has to hide the cake from him because he'll eat all the cake. So we have to watch out for this sometimes. But it's good to have the knowledge of diabetes. Therefore, you know how to help him when sometimes comes, or you know what's best to do in different situations. Because some people, they've even fallen out from their levels being too low, and some people's levels are also too high. So this was just a little education that I wanted to give out on the symptoms and diagnosis of diabetes. Thank you.